On behalf of the School of Public Health, I'd like to welcome you to the second in our series of 3 public discussions about basically the social determinants of health in rural areas, which goes a lot past simply how many doctors are there and how many emergency rooms are there. This is a series co-sponsored by the Arnold School of Public Health and the South Carolina Office of Rural Health, and we are delighted this afternoon to have Dr. Chuck Fluharty with us. And I'm going to ask Dr. Graham Adams, who heads the State Office of Rural Health, to come and introduce Dr. Fluharty.
Dr. Probst. Thank you all for being here. This is the second lecture of at least a 3-part series. We may have more. And really excited about this because it gives us the chance to kind of frame rural more broadly. So often we really look at things, at least from a healthcare point of view, we look at things from an access lens. And that's important, and we can't stop doing that. But it's been enlightening for all of us to think about the other things that impact rural communities and health outcomes in rural. Things like housing, things like can you have a job and earn a wage that you can support your family? Are the schools quality? Is there safe, affordable food available? All those kinds of things that historically those kind of in the healthcare field have kind of ignored and really looked beyond. We're starting to look much more closely at that. And one of the things I talked about with Chuck on the phone was the fact that our state is about 8 months into a state rural health action plan. And we've done state rural health plans before, but this is the first time that we've been purposeful about trying to look at things again more broadly and look at all those things that impact the health of folks that live in rural communities and the health of rural communities themselves. So again, housing, jobs, food, all those kinds of things. So in talking with Chuck, I know that he's a big believer in that kind of broad model and really looking at the things that we can do together, not just the folks traditionally in healthcare, but those that are in school systems and work on housing issues and work on community development issues, who we really haven't engaged historically. So we're excited about that, and we're excited that Dr. Fluharty is here to really talk about his perspectives. I've known Chuck in passing for years. He really has been one of the thought leaders around rural in general. I've been doing this 22 years. He's been doing it longer and has always been out there as one of the experts that helps to guide the way. RUPRI is really what I would say the preeminent institute nationally that looks at not just rural health, but rural more broadly, and really has provided a lot of the leadership throughout the country, helping to further rural dialogue and rural information and data, not fake news, but real information that folks can use. So, Dr. Fluharty, welcome.
Good morning. Good morning. A rural audience. I'm feeling better. It's great to be with you. I had a little bit of an epiphany this morning. I've been in the South now for 2 weeks doing speeches and presentations, and I've been in South Carolina for 3 days, 4 days, 5 days. Time flies when you're having fun. I came in to be with the Arts Commission, who has a project in the Promise Zone around the relationship between arts, culture, and history and the future of economic and community development. So we've got some friends in the back of the room. Would the good arts and culture community please raise their hand at least? There you go. Let's give them a hand. We were over in Walterboro and Allendale, and Susan's here, Sarah Jane, Ken May, who leads that effort. I had an absolutely humbling and regenerative week there, validating what we believe is critical in the theory of change for rural places, which I'll come to in a bit. But I got driven to my knees earlier this morning by a reporter for Politico, if you know Politico. It's one of the leading policy rags in the country. This young woman was definitely not over 27. She was from LA. I'm sure she was trained at Berkeley or UCLA. And I got to learn to quit doing interviews because her lead question was, why does any of this really matter in rural? And she'd probably been in one rural place in her life. And I controlled my Irish ire, but only briefly. And the questions were like, well, what's the difference between rural and urban? So I changed a little bit how I'm going to start today. My title is Thinking Bigger About Smaller Places. And I want to talk about that for a minute, given, and this has happened to me 60 times over 30 years, and I should just quit, but I keep taking the next calls. The reason we've not engaged the rural hubris around the presidential election and everything that's followed with the budget that essentially decimates anything that's innovative in rural America in every sector is that all you have around it is hubris. So we've really not engaged, but I'm in the midst of a long op-ed finally that the Atlantic has agreed to take, and we're finally going to weigh in. So what do I mean by thinking bigger? And it's very consistent with where Graham and Jan are, and I'm so honored to be here, so excited about what South Carolina is doing, because it is exactly the thing that needs to happen. So let's just recognize how deeply important rural areas are to our nation, first of all. 80% of the land mass, 20% of the people. I love global cities. I want to know how long people on that concrete can survive without quality air, quality food, quality energy, and amenities that make their life bearable. You pull those out and you don't have quite as nice a city. Secondly, we have to recognize how important your role is in this work. This is the most important sector in rural futures, without a doubt, because social determinants of rural futures are the critical questions. Now, rural is important because it's smaller, it's farther apart, it lacks technical assistance and scale, and it has fewer votes. The fewer votes is the one that's really important. Frankly, we need more scale and funding. There's no doubt about that. But what do we who care about rural have to do about that? We have to innovate. We have to be serial social entrepreneurs. We have to help one another achieve collective impact across sectors. No sector is sufficient any longer. All are important. So that's my spiel about the reporter this morning. Now I'll come back to my speech. Since we're in the South, I shared this at the arts convening. I'm reminded, I think the greatest final line in American literature is Fitzgerald's in The Great Gatsby. How many of you know that line? Okay, students, go read The Great Gatsby. So we beat on, boats against the current, borne back ceaselessly into the past. The rural issues are not new. We've had trouble getting urban understanding. We've had trouble getting equitable policy consideration and an appreciation that rural and urban are linked in continuums in every sector that have to be better aligned. But rural Americans have got to tell their own story. We've been misappropriated, we've been mischaracterized, and we got to acknowledge and bear witness that we're not telling our story well enough. But then we've got to really try to do something about it. I don't think any sector is as critical as yours. And so I'm going to take a slightly different tack today. In fact, I'm going to take a very, very different tack today. In 2008, I got invited to go to Europe to speak on Cyprus to we do a lot of work with the EU and the OECD, to speak to the Rural Development Conference of Europe, and this was quite a big deal. I was pretty puffed up and full of myself when I got that, and oh God, I'm going to go in and really explain some things to these Europeans. The title they gave me a title, The European Union's Rural Places as Viewed from an American Lens, and I thought, oh, I'll nail that. And then a week before I was to go, this is a big deal, 1,000 people, the banks started failing in New York City. And I ended up going to speak to European areas about what America thinks of them exactly a week after the American economy basically destroyed theirs. Timing is everything, people. But I kept what I said. I'm going to read it to you because it relates to the question today. First of all, I threw out my speech like I did this morning, but then I said, I want to suggest several dynamics are unfolding that will come to bear for all of us. First, Americans have lost faith in most of their major national institutions. Secondly, the two political parties will be next, and this will worsen as party considerations swamp national strategic goals, leading to voter alienation. Thirdly, when this recession ends, and it will, both the U.S. and the EU will look quite differently, but in both continents, citizens will pull back, trust all levels of institutional interaction nearest to them far more than those they cannot touch and feel personally, and the next generation of citizens will come of age with a very different worldview, sense of priorities, and skepticism of the institutions and organizational commitments through which we organize our lives. I nailed that son of a gun, didn't I? Now, I read that mainly so that my wife can occasionally be reminded I was right once. But my point is this. We're in a world where American federalism is finally done devolving to states, regions, and communities. And the real futures we have, because of the divisions in our ideologies, are primarily going to be local and state-based. I am completely convinced of that. I'd like to do 5 things. I want to talk a bit about why that disruption matters. I want to spend just a minute on the rural-urban divide, chat about what I consider to be collective impact and what it means and why it's important. Talk just briefly about some innovators I love that you ought to look at. And then lastly, some reflections on emerging opportunities in rural. We live in an urban nation with an urban hegemony. You can't go to any bookstore without finding 10 or 12 books about how important urban areas are to the future of rural America. My friend Bruce Katz at Brookings was largely responsible for this. He created a metaphor when he said, the city is the economic engine of the American economy. Brilliant metaphor. We can't overcome that one, right? Well, the only problem with that is everybody else grabbed it then. If you know about China, they're going to move exactly 250 million people in 10 years out of their historic home sites where their culture and their heritage of faith in their ancestors has been torn asunder. They're moving them to new cities that will be built. Now, George Bernard Shaw said, all great truths begin as blasphemies. Be careful, because all great blasphemies also begin as blasphemies. But I want to argue that is completely wrong. That is completely wrong. And I want to try to prove it with research. That's not a bad thing in a university, right? I was honored to be a German Marshall Fund Transatlantic Fellow for 7 years. In the midst of that, we did the deepest data dive in the history of the OECD. The OECD are the 30 developed nations of the world. We did a study called Wealth in All Nations. And here is what that study found, very quickly. Don't want to bore you with it. If you want to see it later, it's fine. Okay, so what this is the GDP growth rate for all the global nations. And what we see is the global cities, without a doubt, account for 1/3 of the growth in GDP over the whole world. Amazing. And everything else is 2/3. Everything else is 2/3. It isn't true that they're the economic engine. They're one of the many economic engines of the American economy. But if you look at the map at night, pretty clear what's driving America, isn't it? You can look at cities, just look at Atlanta, Chicago, New York, Minneapolis. What's that one up there on the border? What is that at? What city is that up there? Do you know? Oh, come on, where's our demographers and geographers?
Minneapolis?
No, that's Minneapolis right there.
Fargo.
What is it?
Fargo?
Those are the oil flares and the gas flares from Williston, who we did not know about as a nation 10 years ago. The largest change in the American economy is right up there in that light. It is not. It's in Williston, South Dakota. That's coming everywhere. A rural resource that did not occur in our nation's cities and has radically changed our economy. I just want to suggest, be careful what you vote for. You might be wrong. Systems thinking in rural. Now, I want to argue in health, social work, arts and culture, and any other, do we have another field in the room today? Is there another discipline represented? What field are you in, please? What?
HIV.
Okay, great. I want to argue none of those systems can think about themselves in isolation any longer in a rural sector, and there's 4 reasons. We don't have enough public sector champions in any one of those sectors to succeed. We don't have enough votes. Number 2, every sector is going to be necessary in rural, and they're going to have to start working together because none of them are sufficient. I don't care which one you're in. Thirdly, we have to leverage those investments and those stakeholders and that advocacy support. If you're in the health advocacy group and you're not supporting arts and culture, that's a mistake. If you're in arts and culture and you're not thinking about rural health, that's a mistake. Because we are small and we are not scaled, everybody comes to the family reunion and all are necessary. And lastly, we need next generation thinkers, all of you, in every sector, working together to renovate rural governments. RUPRI has a long history of thinking about this, and we have come up with a unique framing to help you think about what I'm talking about. Rural communities are separated by distance, they lack capacity, they lack TA, and because of that, they need to think more and more about what are the stocks of wealth that you build from, not just financial capital, but all of these. Because largely in a rural setting, we are not as interactive with our neighbors. We are much more self-contained. This builds on the work of Janet Neal Florida, Iowa State, who originally coined it. We've gone on to work in this discipline. We were honored to receive the Lincoln Award from Secretary Vilsack last year. We now have about 30 economists around the country working to build the relationships between these capital stocks. Now, the key thing about a stock is it's not a flow, for those of you that are in economics. Let me use the bathtub metaphor. If you turn on the water in a bathtub and you don't put the stopper in, that's a flow. When you put the stopper in, you're starting to build a stock of water. The point in rural is this. These are all wealth and health potentials, each of these 8. The key is how can you build all of them without detracting from any of them? So if you build your economy around an extraction industry and it destroys the health, the social, and the human capital of your state or your region or your city, to use a biblical term, how have ye been benefited? And now we have to think about building actual empirical relationships between those so decision makers can start to say, you know, that's an interesting financial investment, but is it right culturally and is it right from a natural resource standpoint? Now that's really important because in rural America, what we have to work with is what we are. Our people, our history, our art, our food, our narrative, our culture. We do not need other things to come to us to optimize the assets we have. What we fail to do in most sectors is to look at what the other sectors bring to us. As Wendell Berry said, what I believe in is what I stand on. That leads RUPRI to this model. We've worked around the world for 3 decades thinking about how regions make choice. In today's world, the key thing is quality of place. If you look to any site selection group in business or any human research director, they're going to tell you, we have to find quality places that people want to live in. Because if they're not quality places, those mid-level managers will leave when their kids are 5. And we have made a 5-year investment in a human resource that leaves. In the future, we've turned workforce on its head. Jobs now come to places where people are living. To do that, we've got to have entrepreneurship and innovation in every sector. Private sector innovation, public sector innovation, social innovation, entrepreneurial innovation. We have to have new knowledge networks and workforce. That's a given in every field. But if we don't think about social determinants of health, we fail in that regard completely, and I'll come back to that in a minute. And lastly, we've got to get our stories right. I'm going to talk about Kentucky in a minute. When I did the work there, in the initial convening, I said Kentucky has 3 problems and 1 big one. First of all, Friday night lights. They learn to hate one another. Secondly, family histories. They learn to hate one another. Thirdly, the stories we tell ourselves and the tapes that never change. If your narrative is about why you can't, you will never get to why you can. And the last one is that all of those have to work together across all sectors. Now, I want to talk a minute about workforce. If you listen to our current president talking about how important it is to start up new industries that have been outsourced, that is not true. 65 to 80% of all the jobs that we have lost in manufacturing in the United States is because of one thing. What is it? Innovation and technology. Robots are taking over the human hands dynamic. Why is this important? Because 60% of the working poor drive something somewhere to sustain their family's life. What happens when there is no driver in that car, truck, tractor, or bulldozer? We are not thinking about this as a society. That is why workforce has to rethink what it's doing. Depressed enough yet? I just want to get a quality check. So what do we do? I should mention the 4 other things at the bottom that are absolutely essential. Intergenerational wealth retention and transfer. There's a massive amount of wealth going to leave every rural community in the next 10 years. All us old white codgers are going to go on. We're all temps here, but we're more temp than you. Where's that money going to go when we pass? Is it going to Tampa and Arizona, or is it staying home? First issue. Secondly, I think every community foundation ought to have a health foundation, and I think the majority of the communities ought to receive monies at death to sustain health and social determinants of health strategy. If a state took that on, agriculture would get behind that. No state has. Graham, it's in your court, buddy. Youth, obviously, social inclusion, special attention to social inequality. So how do you do that? Well, there's 3 questions for rural areas. What are you innovating? Where are you diversifying? And where are you transitioning to do Those are really the questions. Sectors make those decisions every day, absent of one another's influence. A tragic failure. If this was a business model with profit centers, you'd go broke. But we consistently do that without talking to one another. It was amazing when we were down in Allenboro. I mean, I find this everywhere where we do work. But there were brilliant, talented young artists and culture bearers in the same county, under 35, who did not know one another. We aren't connecting. So, innovating what? Well, how we consider us. Who are we compared today? Secondly, how we see our region. Is it your town? Is it your county? Is it your region? Is it your big region? How we consider our options. There's all kinds of ways to consider options. One is to think about them and say nothing. The other is to dialogue about them and do nothing. And the third is to do all those and really think together and live out some option strategies across sectors. And lastly, none of this happens unless all of you get supported. Because what we need in rural are connectors. We need bridge builders to all the other sectors. And you're thinking, God, I got a test Friday, what are you talking about? I gotta get through this sector first, for God's sake. Well, how do we diversify? You gotta change your vision in the future. What are we gonna do in the South when no one drives a car, a truck, a tractor, or a trailer? What are we gonna do? Secondly, what's our sense of possibility about that? I'm going to talk in a minute about 19 school systems in southeast Kentucky that had the poorest indicators of success in the state of Kentucky, and it ain't great in Kentucky. Thank God for Kentucky. South Carolina has a friend in indicator work. In 5 years, they have completely turned around those indicators in the poorest counties of Kentucky. They are now doing better in test scores than Louisville and Lexington. Every kid in those 19 poor counties is learning to code in the first grade. They aren't going to be miners in the future. They're going to be running knowledge systems. Amazing. How we change our actions, how we build new collaborations, and what's the narrative out of all that? Lastly, transitioning where? Well, here's my suggestion. If you only look at one thing out of Fluharty's diatribe today, I want you to go to the Stanford Social Innovation Review. How many of you are working in the collective impact paradigm right now? Okay. If you don't know what it is, go read this. This changed my thinking a great deal because I realized what we were doing globally and around the nation is exactly right, and I can now put a name to it. Collective impact. This came out of a study that two researchers at Stanford decided to do to look at, of all the money that philanthropy has put into our major cities, what actually stuck. Did anything actually sustain itself for the millions of philanthropy? You know, philanthropy tells you, if you're a real community, you gotta work together. You got, they ain't doing it themselves. Every one of them has their own mission statement, their own grantees. They continue to favor them. If you need a duck and they have a chicken, you're gonna have to forget the duck and go buy the chicken, right? It's an amazing study. They looked at every city's major philanthropy investments. And here's what they found. I've shortened it quite a bit. But there are 5 components when philanthropy stuck, won, and made sustainable change in the lives of people and organizations. 5 things happened. 1, they built a common agenda across all the sectors. Secondly, they didn't change what any sector was doing. They just reinforced one another's work around a common vision. Thirdly, they created a backbone organization. I think every community, when an expert comes in, should ask this question. Biblical again, I am a trained divinity student. You needed that because prayer is essential for rural policy work. In whose name do you come to us? In whose name do you come to us? Well, you need an organization whose only goal is to make every other organization better. They don't compete with them. They don't try to reinforce them. They're simply there to make everyone better. Servant-led organizational change. Hard to get people to buy that. But where it happens, here's what they do. They create continuous communication so that everybody knows. No one's out of the loop. Oh, healthcare's doing this, and transportation's over here, and the faith community did this, and the football team just won, and everybody knows. And lastly, metrics, metrics, metrics. Prove it to me. What do you mean? Show me how we're doing better. Now, that could be a church, a chamber, a hospital, a school, a 501c3. Could be any organization that says, in our sphere of influence, we're going to make this happen for everybody. I'm going to share 5 quick innovations and then hopefully do Q&A. One of the greatest and most humbling events of my professional life was when these 2 gentlemen called me 3 years ago. Oh, on the right is Steve Beshear, the governor of Kentucky, the poster child for ACE, covered 500,000 people in his state with ACA. On the left is Hal Rogers, chairman of the House Appropriations Committee, one of the strongest conservatives in the American Congress. They had a problem in Kentucky. When the coal mining industry tanked, they lost 12,000 jobs in 1 year in 40 counties. Those jobs averaged $80,000 a year on. So when the family went in to give back the truck loan, they gave back the keys to the house too, because they had no money. They came to me and said, we hear you guys can do this. What would you do? And after about 6 months of thinking about it with them, they decided to finally listen, and we agreed to have a regional discussion. 48 counties in eastern Kentucky, Appalachia, the poorest counties in America, next to the Delta and the Black Belt and the river. Conference was a summit about ideas and innovations that the people wanted to look at. Nothing else. We didn't talk about coal. We didn't talk about any sector. What we did was invite people outside of the political establishment to maybe risk coming one more time, because Appalachia has been studied for 500 years. Since I'm an Appalachian kid, I was able to talk the walk and look like a duck. That's typecasting me. How many can we possibly think, Chuck? I said, oh, I don't know, what do you think? They said, oh, maybe 50, 100, we'll get a church basement. I said, it's gonna be more than that. Let's wait and see. So we decided we'd let them send a card back in if they wanted to come. I said, you're gonna need to get bigger. We started to do the press releases. Got up to about 500, realized the high school gym wasn't gonna work. December 10th, 2013 dawned dark, icy and snowy in the mountains of eastern Kentucky. 5 inches of snow and solid ice. The most humbling experience of my professional life. We were at the regional gymnasium at Eastern Kentucky University. 2,000 Kentucky citizens came to talk. I was crying most of the day. These people had never had a chance in their lifetime to talk without a political control of where they wanted their future to be. And we hit it out of the park on program. We started with 4 young people talking about why they were going to stay home. One young girl was a poet. She had been in New York City. She came home. She was homeless. She was living in her car in Hazard, and her comments to the audience were, "I don't have a home right now, but I am home." I knew we had it nailed from then on. At the end of that day, we had innovation and idea kiosks all around this arena. We had 2,000 long suggestions, and the rest is history. We're now 3 years in. KVEC, the Kentucky Valley Educational Consortium, came out of that. This is SOAR, Shaping Our Appalachian Region. We called it that because we have never shaped ourselves. Others have chosen to shape us. At this point, the communities decided to take it on. That summer, we had 25 working groups. We simply asked people to chair it. People volunteered. There were over 5,000 people in 200 community meetings. This has now resulted in around $150 million in the region. It has completely changed that region of Eastern Kentucky. Please write this down. Go to this. This is the Fire Summit of the Kentucky Valley Educational Consortium. Just go to Fire Summit. We were able to secure a $30 million Race to the Top grant for 19 poor school districts. They made an early decision. We don't need anything we don't have in our schools. We have got great teachers. We have got great kids. We have challenges. They're all ours. We're going to overcome it. They created innovators that were teachers. They created students that were innovators for students. It is the greatest story, folks, of cross-sector innovation. Please go look at KVEC. In those 19 counties, they got the superintendents of every one of those schools to agree on an agenda. We have nurse practitioners and doctors in every school now. We have a family resource center in every school now. Those educational entities are looking solely at social determinants of health. Another model, in West Virginia, the West Virginia Hub. This is an organization, again, collective impact organization, helping others. 250 NGOs in the poorest areas of West Virginia, working together in an NGO. Simply phenomenal, collective impact model. This is one of ours. We decided 2 years ago in RUPRI, we're led by a phenomenal community of national and international leaders. We try to look 5 years out for rural America at what's strategically critical. We decided the two most critical areas for the next 5 years are arts and culture and how critical they are to the future of a rural place. Because if you have a lake, if you have a community college, if you have mountains, if you have a manufacturing plant, if you have some kind of other unique entity, you're going to be fine. If you don't have any of those, what do you have left? The reason everyone sits there. Their history, their church, their culture, their family, their food, their narrative. It binds us to that place. That is arts and culture. When kids come back, and they do, they want their kids to experience the same thing that led them to call that home. You gotta lift that up. The other is brain activity in 1 to 5. I'm gonna run out of time, but maybe you ask me a question about that. Here's why this was important. We created next generation working groups in 3 states, Iowa, Minnesota, and Kentucky. 50 people from arts and culture, 50 people from the economic and community development fields. These are positional leaders, these are secretaries, these are mayors, these are commissioners, coming together to say, how can we work together? This was our summit. We, last October, had an amazing 3 days at the University of Iowa. We paid for 300 young people under 35 basically, who were culture bearers or artists, who could not have afforded to be here. They couldn't have. By the grace of NEA and the University of Iowa and USDA, they came together. It was an amazing conference. These are the people on the final event. On the left is Chris Masson, the fat white guy there is me. Besides me, Chris Massengale, Executive Director of the Delta Regional Authority. Linda Langston, Strategic Partnership Director for National Association of Counties. In the middle, Doug O'Brien from the White House. Next to him, Earl Gould, the Executive Director of the Appalachian Regional Commission, and two folks from Art Place and NEA. The point is this: those are the organizations that supported that summit. Governors, county commissioners, mayors are starting to get that. If you don't build an expressive, inclusive, diverse community, young people will not come home to raise their families there. Some personal reflections. 2 minutes and we still have time for questions. Was originally going to talk about social determinants of health, and everything I've said is about social determinants of health. It just isn't called that. Here are things that excite me or worry me, in no particular order. How many of you have applied for the RWDA Culture of Health grant in any form? Okay, it's one to look at. And the key is there's a major national foundation acknowledging health can't just be about disease management and control. It has to be about the culture in which we think about health before it becomes illness. Make two key points from a public sector standpoint. Do you know what the total investment in health is in any 1 year in the United States? Someone just suggest a number. $3 trillion. We are one of the lowest nations in the world at contributing to human services and behavioral health as opposed to disease management. What the health sector is unwilling to acknowledge is that if they'd spend a little more on the 40% of their overall costs that come from social determinants, healthcare would be cheaper, but you wouldn't be in their hospital. I'm going to tap my own just a little here too, because we all have some scars. I've got real ones, but they have some that aren't quite as obvious. We're getting growing attention to social determinants. I don't really care if it's because conservatives say that 40% has to be looked at. That's exactly a good reason to look at that. And then all the other benefits flow from that. Next issue. Health reform and Medicaid. Jesus, Mary. I'll say two things. What I was most excited about in ACA was the innovation stuff that was just coming, because it was going to let us do social determinants of health and collective impact investing. We were going to get extension services in every rural county thinking about arts and culture, foods, and social determinants in a new way. May not go away. I don't think we're out of that game yet. The new Farm Bill. I'm pretty much behind the screen on a lot of stuff in the federal government, way behind the screen on the rural development title. I'm trying to convince the two committees right now that the new rural development title of the Farm Bill has to be about human capital, because there's nothing as important to rural development as human capital. And if we can get that, you could have a rural development title that looks at art, culture, health culture, and foods, and actually fund them in significant ways. I'm honored to be doing a retreat in several weeks for the Senate Ag Committee. I think we've got a real shot here. The new administration and the new Congress. We're in a disruptive milieu, obviously. I think if our president does nothing else for us, he has given us some big ideas that we have not yet parsed and made real, and that may take a couple years. I think the infrastructure bill is probably the one I care most about, because infrastructure can mean a lot of things. The first thing it should mean no community in rural America does not have high-speed broadband. And the rural commitment for that vote should be that every rural American kid can come home and do their homework on their computer in their place. I don't think that's too great an ask. That helps us with telemedicine, workforce, entrepreneurship, and on and on. Lastly, creative placemaking. We're going to do a conference this fall in DC. It's interesting, this is the 50th anniversary of President Johnson's The People Left Behind, which initiated America's attention to poverty in our country. And we're going to look back and see what worked, what didn't, and how are we changing how we think about poor people. I've been honored to direct a couple national poverty centers, and I'm excited about this. The future of poverty alleviation is not in the federal government. It is in the states, the regions, and the counties, and the towns. Because ideologically, we're not going to do it at the federal government. But you have the data right now to make that case. You do not need outcome data. You have it. I'm going to share one study at the end, and then we get to take a few questions. How many of you know about the Diversifying project at UNC? Let me just share this. 30 years ago, UNC started the first in-depth study of early childhood development. They picked 100 folks in the UNC area that were in poverty, and they divided them into two groups. One was a control group, and the other was the group that was going to get the intervention. Every child in those two families got great child care, full nutrition, and a great safe place. But the half that were having the intervention got one-on-one early childhood attention to vocabulary and reading. 3 years in, nothing had happened. 7 years in, grades started to change. Again, they just did this to age 5. High school graduation, 100% of the innovation group, 42% of the non-group. College attendance, 100% of the intervention group, 22% of the group that didn't get those 5 years of one-on-one attention. End of the day, mic drop for me on social determinants. At age 35, the control group, 48% had metabolic, obesity, or diabetes problems. The intervention group, 0. This study has been replicated many times now. There's a world-famous Nobel laureate at Chicago, James Heckman, who has done a lot of the deep work on return on investment. He puts it somewhere between 6 to 1 and 14 to 1 for that investment. Now, there is a major early childhood investment bill coming in this session, regardless of what happens. I have in no other sector a return on investment argument I can make like that one. Because what are the major social determinants of health we spend money on? Those 3 things. America. We don't lack data, we lack political will. And we often lack it because people in other sectors don't support the sector that says it's their deal. I want to argue it's everybody's deal. I want to commend again the state of South Carolina and this college for taking on this state planning. I think it's absolutely essential. I'll make one last pitch. There's a lot of talk about STEAM. STEM, I want to argue it has to be STEAM. If you know anything about early brain theory, the greatest engineers are the ones that are exposed to arts and culture. Creativity comes from that side of the brain. What happens in our schools, we get rid of band first, if not arts first, and they're both gone, and then we're trying to raise high-quality scientists. Insane. So if I had a strategy for the Promise Zone or for South Carolina, before I worried about anything in this sector, I would worry about let's get all the people who care about this in a room and let's get in the same rowboat. We may be borne back ceaselessly, but we're going to keep rowing on. So thank you all very much, and love to take questions.